All right, so let's start with the TA guide. When you come in, there's going to be a significant amount of prep this week because we are dealing with frogs, okay? So you guys need to prearrange between the undergrad TAs and the grad TAs and decide who's going to do what. You need to make sure that the frogs are on ice for a minimum of 30 minutes before you pith them. So that doesn't mean put them on ice at 8 o'clock for an 8:30 lab because you need to pith them prior to 8:30. So when you go get the ice for the frogs, it's going to be the crushed ice down on the first floor. You also need to fill this bin about halfway full with ice because you'll need to have a cold ringers thing. So just make one trip, it's easier. You'll need to make sure the computers are on, ready to go, and then you need to check the drug supply. Some of them are perishable. The ions like calcium chloride and potassium chloride, they can stay out overnight. The epinephrine is light sensitive. It needs to be put away as soon as your lab's done with it, and don't get it out till just before lab starts. It's wrapped in tinfoil to try to minimize the oxidation, but if we can keep it put up in the refrigerator between classes, that will help immensely. Acetylcholine, pilocarpine, and atropine also need to be kept in the refrigerator. So you need to get those out early so they come to room temperature before they're used, because if they're really cold, when they add them to the heart, it will slow the heart down artificially. Okay, so you need to make sure that you get those out when you get here, except for epinephrine. Epinephrine, if you want, you can get it out and put it in one of the cabinets up underneath to keep it out of the light, but we don't want to have it sitting out in the light. On Wednesday morning, the acetylcholine and the epinephrine will need to be remade. They just don't last very long because they're neurotransmitters. Epinephrine oxidizes, acetylcholine just stops working. I have included the recipes for how to make the solutions in the first page of the TA guide. Okay, so make sure that you are familiar with those. All right, the epinephrine and the acetylcholine, the dry powder, are kept in the freezer in the prep closet. Okay, so you'll need to get those out and measure them appropriately. Keep in mind that these drugs can be absorbed through your skin, and especially the dried form of it is very concentrated. Make sure that you wear latex gloves when you're mixing the solutions. The other thing you need to do is check and make sure that the lab before you hasn't thrown away any of the strings with the hooks for the heart. You'll need one at each table. Okay, so first thing I want to do is demonstrate to you guys how to set up the threads, because if you have them pre-made, it's much easier for the students, and it also helps because if the strings are too long or too short, it'll mess up with the signal on the screen. So I want to show you guys how to remake them. So what we want in the finished product, I have a finished product here. This one's actually a little bit long, but it has all the components that we want. So the first thing we want is a fishhook shaped pin that's an insect pin with a knot tied to it. We want a double string with a loop that's tied at the end. And ideally, this length from the top of the pin to the knot should be about 4 inches, okay? If you get much longer than that, any noise like air movement and things like that can actually cause extra noise in the screen. If you get them too short, then if somebody bumps the frog, you're gonna rip the pin out of the heart, okay? So the first thing we need to do is bend the pin. Now you can use either forceps, curved forceps, or needle nose pliers to do this, okay? If you're going to use for curved forceps, make sure you use the wide old ones, okay? Because if you use the real narrow fine tip ones, it'll bend them and you'll never be able to use them on skin again, okay? So I actually prefer the curved forceps more than the needle nose because the needle nose are much wider, so you tend to get bigger loops in your pin, but you can use either one. So what I'm going to do is I'm going to grab the insect pin, and these are just standard insect pins. You just take one out of this paper. That's how they're stored, okay? And you're going to grab that by the end next to the glass tip. All right, so what I do is I take the curved forceps and I grab it right below that glass head, all right? Then I'm going to take my thumb and I'm going to press the pin so I'm bending it around the end of my curved forceps. So what I get is this really nice kind of candy cane shape tip, right? And that's where the string's going to attach. Now I need to make a hook to go go into the heart muscle, okay? So if I hold the pin by where I've just bent it and I go down about a little bit past halfway, okay? So I want it longer towards the end. Then I take my finger and I bend the sharp part towards me. Ouch, try not to poke yourself. Once you get it started, then you can grab that bent part and continue to bend it to where you get kind of a fishhook shape. All right, and notice that it has a point here down on the bottom, and that's what we want. We don't want it to be a pure fish hook, because then the ventricle will actually slide along. If we have a little point there, then the ventricle tends to stay in that point. To do the string on there, it's actually easier if you have a helper. So Grant, you want to come help me? Sure. All right, so I'm just going to get a length of thread, and I'm going to have you hold the pin by the sharp end. All right, and I'm going to take my thread, and in the middle, I'm just going to hook around the end where my hook was. Make sure my ends are fairly uniform, and then I'm just going to tie a knot. And this is just going to anchor the pin to the thread. Okay. Then what I do is I take both ends together, and I go up about 4 inches, about the distance that I want to start my loop. And there, I'm going to actually tie around 2 fingers. So Grant, you want to let go? It's easier. Hold out 2 fingers together. I think it's easier to tie it around something than to tie it in the air. So I take somebody's fingers, and again, I want to make sure that I have my 4 inches about. Your fingers are too wide. Give me one. All right. So I'm going to just tie a knot basically around his finger. Now, I don't want to tie it tight because, yeah, but this is just kind of giving me a guide so I can tie a firm knot. But I'm going to tie a knot, and just so it doesn't become a slip knot, I'm going to tie extra half hitch. Is that what they're called when you do half of a knot? Boy Scout? Yeah. All right, so once I have that, then I just want to check and make sure that it's not going to slip, and it's not. If it does slip, then just add another half, and then cut off the extra. Okay, so you need to make sure that you have 6 of these ready, prepared for the students, so they can pin their heart with it. Okay, so once we're done with the dissection, I'd like each of you guys to make one so you can practice, but also so we can start the week with extras. All right, and that way, hopefully, it won't be a big burden and you won't be scrambling in the morning. I have already pithed the frogs. We iced them ahead of time, and I pithed 2 frogs. We're going to dissect one first. So we'll be moving over this table. I will need a computer operator and a helper for the dissection.